Well, more news for you tonight. World cancer research statistics indicate that the Bahamas ranks 14th in the world for prostate cancer. Health officials say what's even more alarming is that the Bahamas stands 5th in the Caribbean for the disease. In 2018, there were 200 new cases and 80 deaths. Princess Margaret Hospital's consultant urologist Dr. Gregory Pinto describes these numbers as a national tragedy and an overwhelming problem among men across the Bahamas. With these alarming figures, the urologist noted that prostate cancer is one of the easiest cancers to treat.
In this country, prostate cancer is the #1 cancer for men, and depending on the year, it may be the #1 cancer for the entire population. The worst thing about it is that there's so many unnecessary deaths. Prostate cancer is one of the easiest cancers to treat. Nobody wants to get cancer, but if you were to get a cancer, prostate cancer is the one to treat because it can be picked up very easily at a very early stage, and you can get 100% cancer-specific survival at 5 years. You can get a 98, 99% cancer-specific survival at 10 years. That's if you pick it up early. So you cannot say the same about other cancers. There are very few cancers that can have such a great success rate in terms of cure.
Well, the physician adds that prostate cancer at an early stage has no symptoms. He notes that obesity and sedentary lifestyles put Bahamian men at a greater risk for the disease. He advises Bahamian men at the age of 40 to get a prostate-specific blood test.
You need to get baseline blood tests with your annual physicals every year so that we don't expect to find prostate cancer in 40-year-old men. It's almost unheard of, but it does happen. But what we want is baseline blood tests so that when you may get prostate cancer, when you're 58, when you're 64, we know what the trend has been so we can pick it up very early. If there's any elevation in terms of from one year to the next, or there is one individual elevated value, what we can do is more specific blood tests. We can do urine RNA tests. We can do magnetic resonance imaging. So we can pick up prostate cancer so early now that we can actually actively surveil you.